I am David Schuster of Emory University, and I will be summarizing our manuscript, PPV of bone uptake of 18F-Flotufolastat, evaluation using Spotlight study data. PSMA PET of bone lesions is confounded by increased radiopharmaceutical uptake in benign pathologies, including healing fractures, fibrous dysplasia, and Paget disease. It is important to understand these normal variants and how best to approach interpretation if one is to provide actionable recommendations to the ordering clinician. Last year, 18F-Flotufolastat became the third PSMA PET radiopharmaceutical to receive FDA approval. Yet, it has been questioned if this new PSMA radiotracer evinces greater nonspecific uptake in bone than other PSMA radiotracers. In our experience with both FDA-approved fluorinated PSMA radiotracers, we have found that the incidence of such nonspecific bone uptake is similar. Therefore, based on this hypothesis of similar positive predictive value in bone of 18F rhPSMA 7.3, otherwise known as flotufolastat, or 18F DCF-PYL, otherwise known as piflufolastat, we decided to perform a retrospective sub-analysis of the Spotlight data. Spotlight was a prospective, open-label, single-arm study conducted across 27 U.S. and European sites, which enrolled 420 patients with biochemical recurrence of prostate cancer. 3 blinded central readers analyzed the images, and positives were adjudicated as to standard or truth by a consensus panel using a composite reference standard. 274 subjects had sufficient reference standard on extrapelvic site positivity and thus were subject to the sub-analysis. By majority read, 31% of patients had a flotufolastat PET positive skeletal lesion. The reference standard was histopathology in 29% of subjects and imaging correlation in 71%. The overall PPV was 73%, and across readers was 63 to 80%. PPV was greater in the vertebra and pelvis than ribs and appendicular skeleton. In the pivotal Condor trial, 18F DCF-PYL, otherwise known as piflufolastat, reported a PPV in bone lesions of 61 to 64% across 3 readers, with bone positivity reported in 22 to 24 of 208 patients. These findings therefore confirm our hypothesis that PPV for skeletal lesions is comparable between both FDA-approved fluorinated radiotracers. Another important point to understand is though the PPV is comparable between these PSMA radiotracers, PSMA uptake may be false positive approximately 25% of the time. Therefore, correlation of 18F-Flotufolastat uptake with cross-sectional imaging, histopathology when available, and integration with clinical context and interpretive guidelines may help avoid conflating benign mimics like fibrous dysplasia for metastasis. I would like to thank my co-authors and patients and staff who made this trial possible.